So we're going to be presenting in regards to the new Marijuana Kitchen program, and Travis Ross is going to begin. So if you could advance the slides, please.
All right, so just kind of like what you overheard, my name is Travis Ross. I started with ADHS as the Marijuana Kitchen Inspector back in July. My position was made in response to the 2021 Smart and Safe Arizona Act, which allowed the recreational sale of marijuana to individuals over the age of 21. Before that, in 2011, there was the Arizona Medical Marijuana Act that went in place in 2011, which allowed the sale of marijuana to individuals with a prescription from their doctor. And the two acts are AMA and SASA for short. As of right now, when my program was made, from start to finish, the kitchen, or we've inspected a total of 4 kitchens from start to finish, getting them through the licensing and the pre-operational inspection. Next slide, please. So to start, THC stands for tetrahydrocannabinol. The precursor to THC is THCA, so tetrahydrocannabinolic acid, which is the crystals that is seen on the outside of the marijuana plant. THC alone does not give anyone the high feeling that is associated with marijuana. It has to go through a process, decarboxylation. So in the picture, you can see a red circle. That is the group that is removed from THCA to turn it into THC. The most common way to do that is with heat. So whether that is smoking, vaping, or cooking the THCA, it becomes THC. Then it becomes the right shape to then when it is ingested, it makes its way into the bloodstream, into the brain, and then reacts with the receptors in the brain, giving someone that high feeling. Next slide. So in Arizona, the marijuana market has actually been one of the few markets that has grown rapidly, and not really in response to the pandemic, but more in spite of the pandemic. So a good way of kind of seeing that is in January of this year, it was reported a total sale of $46 million in just marijuana products. 7 million of that reported was, excuse me, was edibles. In comparison to May of this year, a total sale of 116 million just in the month of May in Arizona for the sale of marijuana products, with about $51 million of that total being in just edibles. So just off of those months, it can be seen as edibles are an estimate between 15 to 40% of total marijuana sales in the state of Arizona. Next slide. So with THC and THC infused products, the legalization, whether that was with medical marijuana or now recreational, it is an evolving market. So the most common edibles that the majority of people know about are gummies, gummy candies, but then also like brownies and cookies, but then also other snack foods, chocolate bars, hard candies, mints, pretzels, brownies, anything really that can have an oil coating with the THC oil in it, as well as drinks, lemonades, sodas, iced teas, and then other ingestibles. So cooking oils, so someone can buy cooking oil, cook with it, and make their own infused food at home. It is recommended that if someone does use THC cooking oil, that they cook low and slow, because the THC actually starts to break down at 292 degrees Fahrenheit. Tinctures are more of an oil that you put under the tongue, and tablets are more of just they try to make it as much of your like tasteless pill. When it does come to the sale of recreational marijuana, there are a few stipulations that are in SASA The main ones are a serving of any THC edible can have no more than 10 milligrams of THC. The entire package, whether that's a full drink, a packet of edibles, a whole chocolate bar, cannot have more than 100 milligrams of THC, but that's only for recreational use. Medical marijuana does not have those stipulations because it's a prescription from a doctor. Next slide. So this is just the basic overview of how a facility gets a marijuana kitchen license. The first step is they need to get their marijuana facility license from our licensing group to be just a facility that commercially handles and processes marijuana, whether it's a cultivation site where they grow it or a dispensary where they sell it or both. So they have their license to then just be a marijuana establishment. Then they can visit our website for marijuana kitchens. It has everything laid out that they need to go through and all of the documentation that they need to provide for us to then start the plan review process to get them their license. That is SOPs, their menu, all of their ingredients, floor plans, all of the kind of, basic and common things to get a kitchen permitted. Once there's a little bit of back and forth, then we actually schedule and do our first on-site inspection of the kitchen. This is supposed to be a pre-operational inspection. Everything is supposed to be in place. Everything is supposed to be up and running, but they themselves are not supposed to be producing anything. And as long as everything is good and there's no violations, then they are then given their kitchen permit. Then they are able to actually start producing marijuana infused edibles. And then after that, they are subjected to 2 unannounced inspections a year. This doesn't just go for the new kitchens as well, because when recreational marijuana was legalized in 2021, there were already multiple medical marijuana kitchens that were already making edibles, but they weren't getting the 2 inspections a year. So that is actually something we are working on right now, is getting in contact with these older facilities to let them know that they are going to now be subject to 2 inspections a year to just make sure that they are up to the FDA food code and sanitation standards. So my team, we only inspect the kitchen. Under AMA and SASA, there are multiple inspections that do take place for these facilities, whether it's our licensing team that makes sure that all of their security and all of the rules under AMA and SASA are followed. So our licensing team will look at the dispensary and the site where they're selling everything, and then our sorry, I just lost my train of thought. There are inspectors that go out to the marijuana labs that test the THC for any kind of potential contaminants, but then also to make sure that what they're selling is what they're advertising, that everything is even throughout the edible or the oil or tincture, tablet, what have you, but then making sure that they're not contaminated with any kind of bacteria or virus, salmonella, etc. Next slide. And that is actually it for my part of the presentation.
All right, if you don't mind advancing to the next slide, please. So we just wanted to put a real quick picture of what, we're usually used to seeing on a product recall. And this one was just one from the USDA. And as I'm sure you're all familiar with it, we usually see these recalls of products. In this case, it was a pork product, and it's a more recent one. And so it lists all the information about the product, where it was produced, where it was shipped to. It usually has a PDF of the product so that you can see what it looks like and to see if you have it, for example, in your fridge. Next slide, please. So usual recalls start kind of in this way, right? There's usually a consumer call reporting some sort of symptom or illness. If once they talk to our foodborne illness team, they monitor calls to make sure that there's at least 2 unrelated cases, and that's what we would consider an outbreak. And a communicable disease investigator usually follows up and conducts an outbreak questionnaire with possible affected consumers. So that means they're going to go through a whole list of questions and ask about symptoms, where people ate, if they've been to any events or parties or anything that served food in a large scale, etc. At that point, there might be a link established between a specific food product based on the answers from these individuals interviewed, and our foodborne illness team may be able to identify a retailer or a specific restaurant or a specific product that is implicated, and may even be able to collect samples. So in June of 2021, there was a recall initiated by our Arizona Public Health State Lab. Next slide, please. And so I just wanted to touch a little bit about what our laboratory does and what they license. And so the Arizona State Lab provides support, monitors, evaluates, and enforces the regulation of laboratory testing services in Arizona and statewide, and offers technical resources and training. So the clinical laboratory certification section, they perform tests for the diagnosis, prognosis, treatment of disease, and health screening services of all certified clinical laboratories in Arizona. The Environmental Labs Licensing and Certification is a nationwide licensing and regulation of laboratories that perform environmental testing of drinking water, wastewater, soil, hazardous waste, and air for Arizona. And they investigate complaints and ensure compliance with state and federal laws to assure that high quality standards are maintained. They also provide private well owners resources, and they provide technical resources. They consult and provide technical assistance to environmental specialists and laboratory analysts. Next slide. So through a lab inspection, our Arizona State Lab found a testing discrepancy. So they determined that one of the instruments in an inspected laboratory had found contamination in several marijuana products. However, this laboratory had reported negative results to the marijuana facilities that they were testing products for. And once that happened, they reported their findings to our office, the Office of Environmental Health, and the Arizona Division of Licensing. And so at that point is when a product recall began after the discovery of these findings. Next slide, please. So after that, we began to work together. Once OEH was notified, we started working with our Bureau of Special Licensing, which oversees, of course, the compliance of marijuana statutes and rules in both AMA and SASA, as Travis was mentioning. We worked on a traceback questionnaire for facilities, and our special licensing office was in charge of notifying the affected facilities and sending the questionnaire. For medical marijuana facilities, we have to be very careful because all of their information is confidential. So for that reason, our special licensing folks were able to send a notification that of what happened. Next slide. And so as I was mentioning, the Bureau of Licensing, maybe this should have been before, the it licenses medical marijuana dispensaries, adult use marijuana dispensaries, and dual facilities. So facilities that are going to be selling both or servicing both medical marijuana patients and just people wanting to buy adult use marijuana. And we are responsible for licensing the kitchens in all of these facilities. Next slide. So this is just a quick snapshot of the questionnaire. Pretty much we wanted to find out from the facilities what was the all of their information. We knew what facilities were implicated, but just to make sure that some of those facilities have different locations, just to make sure what facility we were getting all the information about. We had follow-up questions such as, when was the last date that they sold the product? Did they still have the product in their possession? So due to the fact that our laboratory found the discrepancy through lab equipment, they knew specifically what products had been tested and were positive. They knew batch numbers. And so in that way, we were able to link the product to the facilities, and we were able to contact the facilities to ask if they still had the product, did they sell it, who they sold it to, and to begin actively doing a recall. Next slide. So as mentioned, a notification was sent to the 10 affected facilities by our special licensing team to let them know that the results they received reported no contamination, when in fact certain products were contaminated. And the contaminants found were Salmonella and Aspergillus. Per the marijuana rules, products contaminated with Salmonella must be destroyed. Products found to be contaminated with Aspergillus can be remediated. And this is for AMA, for the Arizona Medical Marijuana Act. For the Adult Use Marijuana Act, there are no requirements for testing. So the tests were done on products that were being dispensed in a medical marijuana facility. So again, facilities were asked if they had any remaining product with the same batch numbers, to take a look at their inventory, to take a look at all their documentation, especially the marijuana medical marijuana facilities. It is one of the requirements that they keep very specific records on their computer systems, and they make sure that they know exactly how much they sell, to whom they sell, and all of that. Next slide, please. So as you are, I'm sure, are very familiar with the symptoms of Salmonella, symptoms can usually begin 6 hours to 6 days after infection and last 4 to 7 days. Some people do not develop symptoms for several weeks after infection, and others experience symptoms for several weeks. As you know, nothing's just set in stone. Everybody's body reacts differently, but the main symptoms are diarrhea, fever, stomach cramps, vomiting, nausea, and headache. Salmonella strains sometimes can cause infection in urine, blood, bones, joints, or the nervous system, and can cause severe illness. Next slide, please. And for Aspergillus, if you get invasive aspergillosis, the symptoms can develop if the infection spreads from the lungs to other parts of the body. And these are some of the symptoms, which would be fever, chest pain, cough, coughing, or shortness of breath. Next slide, please. Go back one, please. Okay. So for the results of the questionnaire, certain facilities had the entire batch of the implicated products in their possession, so no consumers were exposed, and that was a really good thing. Some facilities had already sold the products that were suspected to be contaminated. They were asked to actively recall the products, to actually put a recall warning on their respective websites, ADHS posted a recall warning as well on our website, just to let the public know about this products that were implicated in this contamination. And we, next slide, please. So this was just, I did a screenshot of what went out in the media. This one's from the Arizona Republic, that, you know, there was a voluntary recall issued for some of the marijuana products sold in Arizona due to possible contamination. You can, guys, feel free to go look it up. Next one, please. And so again, the results, the consumers were asked to dispose of the implicated products. Again, there were specific names and batch numbers. Consumers were asked not to vape, smoke, or otherwise consume any of the products. So if they had edibles, not to eat them, of course. Consumers were asked to contact the facilities or dispensaries for additional questions. If they had any additional questions, they were able to contact the dispensary where they purchased the products. But we monitored calls. Our foodborne illness team was also notified that, you know, something could come up through phone calls that we get regularly, but no illnesses related to this recall were reported to ADHS, or at least not to our knowledge. Next slide. I think actually this is the end of our presentation.